দর্শক আমন্ত্রণ আরটিভি নিয়মিত আলোচনা অনুষ্ঠান ফোর্থরাইটে। এই অনুষ্ঠানে আমরা কথা বলি বিভিন্ন সেক্টরের বিশেষজ্ঞদের সাথে, যারা বাংলাদেশ নিয়ে ভবিষ্যৎ পরিকল্পনা ও তাদের অভিজ্ঞতা নিয়ে আলোচনা করে। এক অস্থির এবং অনিশ্চিত সময় অতিক্রম করছি আমরা। করোনা নামক এক অদৃশ্য শক্তির বিরুদ্ধে লড়াই করছে সারা বিশ্ব, কিন্তু কি করে এ থেকে পরিত্রাণ পাওয়া যায় তার উত্তর খোঁজার চেষ্টা করব ফোর্থরাইট অনুষ্ঠানে। আপনাদের সঙ্গে আছি আমি শ্রী রাশিক রহমান। আজ কথা বলবো দ্য রোল অফ লোকাল গভর্নমেন্ট টু প্রিভেন্ট কোভিড-19 ইন বাংলাদেশ। আর বিষয়ে আলোচনার জন্য আজ আমাদের সঙ্গে রয়েছেন স্থানীয় সরকার সমবায় ও পল্লী উন্নয়ন মন্ত্রণালয়ের মাননীয় মন্ত্রী জনাব তাজুল ইসলাম এমপি এবং বাংলাদেশে জাতিসংঘের আবাসিক সমন্বয়ক মিয়া সেপ্পো। Very welcome at Forthright. Firstly, I would like to thank Honorable Minister and Mia Seppo for joining with us. Very good to see all of you. It's an open platform, so any one of you can ask each other. I would like to start with Mia Seppo. Now, Bangladesh is faced with an unprecedented crisis. Initially, COVID-19 considered a public health crisis. This has quickly become a multidimensional humanitarian crisis. In your view, what is Bangladesh's status to fight against corona pandemic?
Thank you. Thank you for the question, and thank you for this opportunity to join the conversation together with the Honourable Minister of Local Governance and Rural Development. I think you describe it very correctly. This was a health emergency which around the world is now taking a much more complex, much more multi-dimensional, multi-sectoral face. And I think from that initial expectation of a short crisis, the world is getting to terms with the fact that this virus will stay with us for some time and will influence life and economies and societies for some time. In Bangladesh, you have indeed a very complex situation of crisis. Bangladesh is generously hosting the Rohingya refugees down in Cox's Bazar. That's one crisis dimension. Now we have the COVID pandemic on top of that. We have the recovery from the cyclone Amphan, which of course is a strength of Bangladesh in terms of disaster preparedness and response. But this time the response had to also take into account the need to contain the spread of the virus. And then you have the fact that Bangladesh is an open economy linked to global supply chain, where the export market is very much in countries that the virus has brought to its knee and brought economies to a standstill. So that, together with the informality of the economy, means that the socio-economic impact is potentially very big. So what we are seeing is, the health response running in parallel with the efforts that the government has launched under the leadership of the Honourable Prime Minister to make sure that the lockdown measures cater to the most vulnerable in society through food and cash distribution programs. This will be a challenge because no clear estimates, but there's obviously a lot of people who have fallen back into poverty because of the crisis. And therefore, as the government has decided, there needs to be an expansion of social protection programs, and that then needs to be done with proper targeting, using the capacity of Bangladesh to also put in place digital platforms.
Thank you very much for mentioning our socio-economic status. Mr. Tajul Islam, to fight against coronavirus, our Honorable Prime Minister emphasized to engage local government like Upazila Chairman to Union Parishad members. How does this initiative works?
Excess thanks to Mia Seppo to join with in this occasion. Actually, from the day of grooming this virus in China, so we were observing the situation, and when it had been migrated to the Italy and some other European countries, didn't time we are not actually impacted. In our country, we did not be affected. But under the leadership of our Honorable Prime Minister, a national committee have been formed to face in case of these kinds of pandemic could attack in Bangladesh. So under the leadership of Health Minister. So And as an alliance minister, local government ministry also joined in the national committee. So pure responsibility have been delegated to the local government ministry. Actually, local government ministry is very important ministry in context of Bangladesh because it have a entity all over the all the even remote areas. There is a union parishad where there is a good numbers of the public representatives there, union member, and Upazila chairman, Purushoba, and Purushoba councillor, Purushoba mayor, and city corporation. So from the day of beginning, the government have taken initially, we tried to manage this COVID situation by locally isolation and quarantine. The people, those who came from outside, our public representative, all the union member, chairman, and other all representative, including the mayor and the councillor, including I myself, we have seated several times to perform from our contest. How good we can do very seriously.
Honorable Minister, Mr. Tajul Islam. Besides 350 members of parliament, more than 60,000 people are involved in local government. Do you think that during this coronavirus pandemic, they are doing their duty properly?
Yeah, I believe that all the member chairman and the member of the parliament, Upazila chairman, they everybody, more or less everybody. But a very negligible, non-specific numbers of the people you may have identified, they did not be attended properly. It could be happening. But it was not that much visible as because the people we did not we have given the instruction not to go physically, so they have organized virtually. So this is why it was not that much visible, maybe sometime. So we tried to communicate with each other and cooperate each other. Through that, we have tried to face this situation. Actually, our health status and national economic status and our employment and agriculture, everything is growing. Not actually, this is not that comparable to the any European country. Despite that, I think if I can compare the European countries and even USA, there is a lot of situation they are facing. Actually, the situation what they are facing, they did not even predict this kind of situation could be rise there. So
unprecedented situation it was.
Yeah. This situation actually definitely there is some unpredictability and there is something actually maybe could identify something which did not been attended, which did not been addressed very properly. So despite all this situation, actually there is many challenges is there still is remaining. So actually where I want to emphasize, they actually as we are a very densely country, we are graduating to the developing country, but our many people actually all the people is working and from an output of that. As Seppo rightly have pointed out that we have a problem with the Rohingya Ampan situation we have faced, and another issue, the dengue issue last year we have experienced. So there is you see economic situation, the export is actually it have been shut down. All the garments factories, mostly on the Bangladesh was defending on the RMG, and the remittance, the huge people is living in abroad, so they are sending the money. So this money, all these things have been misspent. Despite all these things, because our Prime Minister, she's very courageous and dynamic and very knowledgeous, and she knew how the situation have to face. So we are working under her command and the leadership, and the situation is still, I think, in compared to the South Asian many other countries, Bangladesh is manageable. But from my ministry, you see the hand wash, hygiene, and sanitation, about all these issues. This is very and the water supply. So hygiene,
personal hygiene.
So I ensure. I have given the instruction to all the water supply entity. They have ensured the water supply, and from the day of beginning, I myself have given the sanction, including even up to union level. We have given the 10,000 taka to the union chairman for buying the soap, and we have set up in everywhere there is a hand wash block. So this and disinfection in Dhaka city and many other all cities, and the local government entities have taken the responsibility to work spraying for the disinfection. A lot of things have been done. So
thank you, Honorable Minister. In this regard, Seppo, would you like to add something?
Thank you. I certainly wasn't prepared to have a question for the Honourable Minister, but just to say it is good that there is a coordination at the centre of the government between all the ministries, because the complexity of this crisis requires all hands on deck. So that coordination is important. As the Honourable Minister pointed out, every ministry has a role to play, and the Ministry of Local Governance and Rural Development has a very important role to play. The water and sanitation sector is a very good example of that. But across the board, there's only that much you can do to really get the health sector ready in the short term. I mean, as you saw, countries with stronger health systems in Europe and the States collapsed under this virus. So all the other work, which is kind of non-medical, to work at the community level to stop the spread, to get the message out on how people can protect themselves, to get information about the virus and how to take care of yourself at home is absolutely key. And I think it's that coming together of all capacities is so important. Maybe the minister could elaborate a little bit on that multi-stakeholder partnership between government, development partners, local authorities, officials at the local level, and also the fact that Bangladesh has something that not all countries have. Bangladesh has a tradition of strong NGOs and community-based organizations which can be mobilized for a very local response. And second, Bangladesh, of course, has a production capacity that many other countries don't have. And also that capacity is being mobilized to make sure that not all of the supplies have to be imported, because now we're in an extraordinary situation of rich countries and poor countries competing over the same supplies which are in short supply.
Exactly.
So the global supply chains are broken. And so I think Bangladesh capacity to mobilize the communities and Bangladesh capacity to actually do some of the critical production itself is something that is key.
Well, Mia Seppo, there is an UN strategic framework for Bangladesh. So does that have to be changed according to this current pandemic?
So, what you see globally is it's a process of global learning. Some of the lessons from other countries apply, and some of them have to be clearly adjusted to local context, because the local context in Bangladesh is very different from, say, Spain. So it's the process of global learning, it's the process of continued new information about the virus itself that requires an adaptive strategy. So from the stages of prevention to where we are today in Bangladesh, which is community transmission, of course, the strategy has to be continuously adapting to the new situation. But however stays is the health, the scaling up and strengthening of the capacities of the health system, led by the Ministry of Health and DGHS, and the UN is aligning its support behind the government's efforts to respond to this pandemic.
Well, thank you. Thank you, Honorable Minister, and Mia Seppo. We'll talk more after a short break. দর্শক দেখছেন RTV নিয়মিত আলোচনা অনুষ্ঠান Forthright, এই পর্যায়ে নিচ্ছি বিরতি, ফিরছি একটু পরে। সে পর্যন্তই আমাদের সাথে থাকুন।
We jointly did a lot of meeting, and from all this meeting, we have decided and we have delegated the what responsibility who will perform. So this is why we tried actually nationally. Before we did actually informally. Now we are going to do these things formally. That is, we are the area where there is that's maybe small area, even Dhaka city, maybe one ward, there is 100,000 people still living. Within 1,000 people in certain particular area, maybe 100 people have been infected, 200 people have been infected. So we could say this is the very vulnerable and this is the red alert area. So if we can confine this area and contain the infection in particular that area, so that maybe many other area if there is no infection. So this is the actually in the same way you saw Rajar Bazar, one of the ward which have been started as a first trial of the declared as a red zone, and it has been locked down fully. So we are trying to contain the infection within particular that area, so it will not get the chance to spread there. Maybe full Dhaka is not then infected in some particular few areas, and we have started and we have found out, and through the study report, and we have fixed these kinds of taking these kinds of strategy to face this present situation.
Mia Seppo, it is clear that by ensuring social distance, we can reduce the number of cases during COVID-19 pandemic. How an overpopulated country like Bangladesh can ensure social distance during pandemic? What is your experience?
Thanks for the question. I think we need to change our language and stop referring to social distancing and refer to physical distancing. It's a question of a physical distance socially. Countries that manage to come together and really work together across private sector, government, civil society, everybody are able to respond to this pandemic. So let's start referring to physical distancing rather than social distancing. But you're absolutely right. I mean, the whole advice around physical distance is way easier in other countries than it would be in Bangladesh, and in particular in certain areas of Dhaka, or not to talk about the Rohingya settlements, as was mentioned earlier, where physical distancing is a luxury. I mean, those of us who can work from home and effectively work from home should do so, but there's a lot of people for whom that is not an option. That simply would mean not having food on the table. So that has to be taken into account. I think there's a couple of things. As the Honourable Minister said, these highly densely populated spaces are favourable conditions for spread of any communicable disease. So COVID, anything else. So we welcome the fact that the government has restricted mass gatherings. We welcome the decision to keep the schools closed while strengthening the various efforts of digital learning and lectures on TV and all the things to make sure children still learn, and also to limit public transport, which is otherwise a potential risk of spread. We also welcome the decision by the government for compulsory mask wearing when you're outside. I mean, research was a bit hesitant in the beginning. It's a good example of how things change. So in the beginning, there wasn't strong advice for everyone to wear a cloth mask. Now it's very clear. The public, everybody is advised in densely populated areas to wear a cloth mask when outside. Not disposable masks, because then we add to waste, and definitely not medical masks, because those need to be reserved for frontline workers and healthcare workers. Cloth masks already, if you have a cloth mask and you respect the physical distance, you are already bringing down the risk of transmission quite a bit.
Mia Seppo, in Bangladesh, what sort of initiative has been taken by United Nations? Is there any specific program to assist Bangladesh on COVID-19?
Sure. There is very close collaboration between the UN and the health authorities on all aspects of the response, from looking at the surveillance and laboratory to support, to contract tracing and mitigating community transmission, looking at the points of entry and quarantine, infectious prevention and control. Lots of effort together with government and NGOs on risk communication and community engagement. This is key because misinformation actually puts people's lives at risk. So it's very important that everybody knows how to protect themselves. And of course, case management. Then you have efforts of making sure that, basic services is key, from services for women, because violence against women is going up, to services and, water sanitation, but also essential health services. I think the word should never forget that during the Ebola crisis in Sierra Leone, the number of people who died from other preventable causes was bigger than the number of people who died from Ebola. So it's key to make sure that other essential health services are available to people in addition to COVID care. And the new normal, therefore, needs to be a word which is more inclusive, more resilient, and more aware of the need to protect the environment.
Well, thank you very much. We are almost end of this discussion. Honorable Minister Tajul Islam and Mia Seppo, a common question for you, if you address it shortly. Experts says that it is not possible to act after this pandemic, as if globalization has come to an end and that everyone has to close its doors amid rising protectionism. How does our global leaders should behave in these circumstances? Honorable Minister Tajul Islam.
Yeah, rightly you have pointed out. Actually, this is now we are saying that this is the global village. So we are not actually far from each other. By any means, we are coming to the in connection and communication. So this is why there is a pandemic could be spread actually much more speedy than any pandemic in any other decade have been or any other century it have been attacked in the world. So, but actually global leaders now, I think that globally all the leaders and all the organizations are humanitarian organization, including UN, World Health Organization, everybody is working together. So as early as possible, detect could become. And nothing to be that much worried. And people all over the world, in world life, they face many situations. And this is one of the situations maybe. And hopefully.
Thank you very much. Thank you, Honorable Minister, Mr. Tajul Islam. Mia Seppo.
You referred to walls. I think it's important to keep in mind that there's no walls that would ever be high enough to protect you against the virus. And if the world doesn't recognize that, and if it doesn't recognize that no one is safe unless everyone is safe, then obviously we're going into a further fragile and uncertain future. It is very encouraging to see countries like Bangladesh, who has always been a very strong member state of the United Nations, to indeed join that call for multilateral responses, multilateral solutions of coming together. In that process of global learning, there's a lot that Bangladesh can share with the world based on its experience of managing fragility and based on its development trajectory. And of course, equally, there's lessons that Bangladesh can pick up on and adapt to the Bangladesh context. I think it's important to recognize the conversations that are happening under the UN's auspices globally. Following the policy statement by the UN Secretary General on people on the move, there was a discussion between Friends of Migration in New York, where the Bangladesh permanent representative very much raised the issues that the Honourable Minister referred to earlier as well, in terms of labour migration, access to social protection, healthcare, and global responsibilities, given the importance of labour migration. And we have to recognize that people will continue to move. This is not going to stop human movement, and that movement therefore has to happen in a context that is safe, also if there is a pandemic. And I think the last thing is to keep in mind that we have to respond in a manner that doesn't increase stigma of vulnerable groups or certain groups, different groups in different countries, but a worrisome trend that you can see around the world. And maybe there, it's very encouraging to see how the world has galvanized and mobilized, and the strong support for anti-discrimination, anti-racism that the Black Lives Matter movement has mobilized around the world. A rights-based approach is absolutely key. So let me just finish with one sentence from the Secretary General, who said, "Only by coming together will the world be able to face down the COVID-19 pandemic and its shattering consequences." Thank you.
Thank you very much. Thanks for being with us. Natok, আমরা প্রায় বলি পৃথিবী একটি বড় গ্রাম। গ্রামের মানুষ যেমন নিজেদের সুরক্ষার জন্য একে অপরের উপর নির্ভরশীল, তেমনি বিশ্বের সুরক্ষা সম্ভব যদি সবাই একে অপরের প্রয়োজনে পাশে এসে দাঁড়ায়। দেখা যাচ্ছে এই মহামারীর কারণে গোটা বিশ্ব এমন এক পরিস্থিতির মুখে পড়েছে যাকে এড়িয়ে যাওয়া সম্ভব নয়। কোভিড-19 এমন একটি দীর্ঘমেয়াদী সংকটের ইঙ্গিত দিচ্ছে যেখানে কোনো একক দেশের পক্ষে সামাল দেওয়া কঠিন। ফলে একে অপরের প্রতি নির্ভরশীলতা ভবিষ্যতে আরো বৃদ্ধি পাবে বলে মনে করছেন বিশ্লেষকেরা। তবে পারস্পরিক এই নির্ভরশীলতার আদলে বিশ্বায়নের ইতিবাচক পরিবর্তন ঘটুক, সেই প্রত্যাশায় শেষ করছি আজকের অনুষ্ঠান। এতক্ষণ সঙ্গে থাকার জন্য ধন্যবাদ সবাইকে।
For more updates, subscribe and press the bell icon on YouTube app and never miss another update.